We're starting then with the Ivory Coast and our correspondent Sam Bradpiece. Sam, the Ivory Coast then sharing a border with Ghana. Tell us a bit about how the news of the rollout in Ghana has been greeted where you are.
Well, yes, interestingly, actually, while Ghana was the first country to receive these 600 doses of the Covax vaccine, Ivory Coast will be the second country, but it will be the first country to roll these vaccines out. Ivory Coast plans to begin vaccinating its population on Monday, whereas Ghana is going to be probably slightly later next week. So while the vaccines did arrive first in Ghana, the rollout is happening first here in Ivory Coast. And these vaccines will go as a priority. I spoke with the health ministry here this morning. They'll go as a priority to the security forces, to frontline health workers, and to teachers. That's how things will be prioritized here in Ivory Coast. In Ghana, there's a similar kind of prioritization going on. But it's perhaps slightly more orientated towards vulnerable population groups, so the over 60s, those with comorbidities, but also frontline health workers, as is happening here in Ivory Coast. This COVAX scheme is incredibly important, and equitable vaccine distribution is important, because if we leave some countries unvaccinated while others kind of tear ahead, what you'd see then is new variants popping up. And if these new variants aren't controlled and monitored, then even the countries that have vaccinated their populations face potential vulnerability in terms of, we've seen with the 501YV2 vaccine, for example, in South Africa, that it is harder to treat or harder to prevent, as it were, with the AstraZeneca vaccine, for example.